Let's all right, you know what, Ben, I want you to do another segment with us if you could give us like another 10 minutes.
Yeah. Yep.
Let's talk about there was a big hearing today. Dr. Fauci was on I guess not on. There was a hearing in the Senate about this notion of reopening. And we know that, of course, there's a completely shambolic process in the White House. And Dr. Fauci is still holding the line basically on if we prematurely reopen, there's going to be even more absolutely preventable death and suffering. We're at well over 70,000 deaths now at this point, right? Mm-hmm. In terms of what's been documented. We all know that with the problems of testing and everything else in this country because of their, our shambolic healthcare structure, you can very safely say, obviously, that these numbers are higher. And, a couple of things to do in the background here. And we'll start with Rand Paul, who's pushing for schools to be reopened. And he wants to know about how kids are being affected. Now, we're going to have a little bit of fun with this. But, I mean, one of the most disturbing reports that are starting to emerge in New York right now is that there might be some variant or some outgrowth of this that is affecting school children pretty specifically, apparently. And this could be, and again, like all of these things. And one of the reasons that maybe at some future point we'll do a little bit more epidemiology and public health content. But I think unless you really have a precision as best you can on this stuff, it's better just not talk about it. So I'm not going to, run with every possible speculation. But the point being is that the consensus is stay closed. And obviously Fauci is facing an uphill battle. I have no doubt that there's people inside the administration who, both for all the ideological reasons we outlined and the fact that they don't want to pay unemployment benefits in these Republican states. And also, I think, frankly, let's be honest, I have no doubt that that the Trump White House is looking at the breakdown. They're saying poor people, people of color, not necessarily geographically important to the reelection. Who gives a fuck? I mean, again, this is a murderous death cult that has no care for human life, and certainly no care for human life that isn't part of its electoral coalition or identitarian politics. It's white identitarian politics. So, all of these things, political calculations, racism, all of these things are operating in the White House's calculation. This is Dr. Fauci trying to hold the line. I'm not particularly interested in valorizing the guy. He's become another kind of embarrassing resistance totem. Although I will say, finally, they pick one that's actually doing something. He isn't part of a, fool's errand political investigation that will amount to absolutely nothing. He isn't somebody who actually is enormously destructive themselves, but rolled their eyes at Trump once or whatever other kind of embarrassing figures that these idiots have rallied around. He's a doctor. It just so happens that the guy at the CDC somehow in the Trump administration has some experience and takes his job seriously. When this thing first broke, I remember saying, before I had any idea who this guy was, I remember saying oh, that's great, because probably who's ever in charge of this for the CDC or whatever is probably a colloidal silver salesman. Well, no, I was wrong. It so happens that it's Dr. Fauci, which is why, and I'll stop in a second, and the damage is probably already done, but the resistance types should have been interviewing Dr. Fauci and being like, so what's it like working for the best president in the history of the universe? How much do you respect Donald Trump on a 3 million to 10 million scale? Not trying to figure out a way of him calling the president an idiot and getting him marginalized. You should have been saying, isn't Bill Barr disrespectful? Anyways, resistance peoples are morons. This is Rand Paul. I can't even summarize this line of questioning. And Rand Paul with that beard, increasingly Alex Jones-like. Let's check this out.
Much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. We can listen to your advice, but there are people on the other side saying there's not going to be a surge and that we can safely open the economy, and the facts will bear this out. But if we keep kids out of school for another year, what's going to happen is the poor and underprivileged kids who don't have a parent that's able to teach them at home are not going to learn for a full year. And I think we ought to look at the Swedish model, and we ought to look at letting our kids get back to school. I think it's a huge mistake if we don't open the schools in the fall. Thank you.
Mr. Chairman, can I respond to that even though there are only 32 seconds left?
Yes, and you might make it clear whether or not you suggested that we shouldn't go back to school in the fall.
Well, first of all, Senator Paul, thank you for your comments. I have never made myself out to be the end-all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence. There are a number of other people who come into that and give advice that are more related to the things that you spoke about the need to get the country back open again and economically. I don't give advice about economic things. I don't give advice about anything other than public health. So I wanted to respond to that. The second thing is that you use the word we should be humble about what we don't know. And I think that falls under the fact that we don't know everything about this virus. And we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. For example, right now, children presenting with COVID-19 who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. So again, you're right in the numbers that children in general do much, much better than adults and the elderly, and particularly those with underlying conditions. But I am very careful and hopefully humble in knowing that I don't know everything about this disease, and that's why I'm very reserved in making broad predictions. Thank you.
Thank you, Senator Paul.
Fuck you. I had it myself and I went swimming. Whatever. Maybe kids should be a little bit more athletic.
What's also,
I like that frame though of like, you should be more humble. And it's like, no, you're engaged in the ultimate arrogance.
Yeah.
the ultimate. You're going to get thousands of kids like in danger because of
you want to endanger thousands of kids' lives because of your false sense of comfort and your own ideological agenda. And you're telling me that this other person urging caution is arrogant.
Rand Paul all of a sudden too develops like a deep concern for the public education of America's children, right?
Yeah, fuck off.
Yeah, that's right up there with Stephen Molyneux being concerned that immigrants are taking jobs from black people.
Right.
Right. No, I mean, I can't, every time I see him, I always think that Alex Coburn column from 2010 when he was running for president the first time. It's called The Rand and Rachel Show, and there's like a paragraph about that like famous Rachel Maddow appearance, and the last sentence is just, he seems dumb.
And also mean-spirited, yeah.
Yeah, no, well, sure, definitely. He swam in the Senate swimming pool while he was waiting for his test results. Like, I'm not endorsing his neighbor's actions, but I kind of think you can get a sense of how it might have come to that.
His neighbor's awesome. All right, let's.
Can I just say
go
quickly, like, kind of what was? First of all, I should have said millions of kids, not thousands. And also,
millions, right.
What was kind of significant about Fauci's testimony is that he stressed that we're not opening up too early just based on the disease's timeline, but also based on our lack of preparedness to do things like contact tracing. Right. Basically he played it. It was very like subtle, but I mean, as a shot to like governors and Trump himself, it was pretty interesting. Like, I was surprised he went that far, frankly. But I mean, I guess hopefully he continues to do that. I
mean, maybe you can just tell Trump that it's like Obama's fault or what. I don't know. Whatever story you got to tell Trump to be able to say stuff like that.
I just want to make sure that we don't also let Rand Paul get away with his Sweden example, by the way, too.
Or his beard.
I mean, where it's like, people are like, thousands of people are dying at an alarming rate. And like what we're getting from the Swedish government about the death tolls in Sweden is that it might look good in the long term, right? Like once like the coronavirus like kills thousands and thousands of people around the world, then maybe we'll look like it wasn't as bad. But I mean, they're like the devastation in nursing homes and with the elderly population there has been like horrific.
It has, and I don't want to be too. I mean, I take Michael's point earlier about not like pretending to know a lot about epidemiology or anything, but my understanding is that like Sweden, the restrictions are a lot looser than elsewhere, but it's not like they're not restricting anything. The point is not that what they're doing is okay. What they're doing seems to be a disaster, but like the theory, if you go along with it, is they're getting a bunch of deaths up front, but they'll get these herd immunity benefits or whatever. But I think that if you were really going to try to do that, right, like what Boris Johnson was saying at first, that he was going to do in the UK, I think you'd just have to go a lot more balls out than this, like because like if you really wanted to just like get everybody infected right away, you wouldn't just like keep restaurants open, right? I mean, you'd be like really just not restricting anything, just trying to I don't know, do like chicken pox parties for adults to get COVID, and that would I think be such a humanitarian disaster that just nobody's going to do that. So I think what's actually going on is they're just kind of half-assing it, and they'll get tons of deaths right away, but it's not at all clear, at least based on what I've seen, that they're actually going to get this benefit.
They want to coerce people back into the labor market. I mean, that's the point. They don't want to pay unemployment, and they want to force people back into the labor market. And I think they do want to juice the economy. They are juicing the stock market, but it's going to be, from an economic perspective, is a disaster because they're not taking into account, the behavioral changes that are going to, people aren't going to go back out to theaters and restaurants. But I really think the primary reason is they don't want to pay unemployment insurance, and they don't want to have a broader conversation about social infrastructure to help people stay home.
Yeah, absolutely. And, and the thing, and the super annoying thing about this is you can open up at a not unreasonable time frame if you're willing to do everything you need to do leading up to that, as far as test and trace and having a real lockdown up till that, right? I mean, certainly we've seen that in like the South Korea case, and even in North America, like Vancouver, the NDP government there seems to have done like a pretty good job on all fronts, and they're talking about safely reopening, relatively soon. But of course, that has nothing to do with the U.S. discussion, since that's just entirely about saying, all right, well, it's been too long. The capital's losing too much money, right? We've just got to start feeding people into the death machine.
Well, I mean, it's like what Zizek said too when he was on the show a little while ago. It's like, there's essentially like social, isolation, social distancing for the rich, right? And then just feed everybody, the rest of the world, into this virus, be them older folks who are, compromised, migrants, workers. I mean, it's very clear that, it's more extreme in countries, in places that are opening up like Sweden, and now what's happening across the South with it reopening. But you see it everywhere in New York as well, that there really are two classes when it comes to the COVID crisis.
Oh, without a doubt. Yeah. I mean, there's no doubt. And that's another really important,
and that's the bigger point
core way of understanding.
That's going to continue, and it's going to get worse as you start, because you're going to have to start letting people go back to work. And the people who are going to be able to stay home are people who can work from home or just don't have to work because they have lots of money. It's going to get even more pronounced.
Yeah. I mean, look, a few weeks ago, when my governor, Kemp in Georgia, reopened almost everything. I saw a social media post by somebody who said they called the governor's office right after that happened to ask when they could schedule a tour. And they're like, oh, what are you, crazy? We're not doing tours. There's a pandemic going on.
That's awesome.
Right.
You just watched a Michael Brooks show video. Subscribe to get them all. Why wouldn't you? Don't be foolish. Click subscribe below and become a patron as well. Patreon.com/TMBS. Thanks, everybody.